and Assalamualaikum everyone. Today, me, NURIN HANISYA binti ABDUL HALIM, and my partner, UMMAIRAH binti ASMAPI, will presenting about the role of leadership in preventing burnout in the Malaysian healthcare sector in 2021 to 2025. Now, let's start with introduction by UMMAIRAH. Hi and Assalamualaikum everyone. Today, me, NURIN HANISYA binti ABDUL HALIM.
The COVID-19 that we know was a turning point for a Malaysian healthcare system. Doctors, nurses and frontliner faced very extreme pressure for long working hours, emotional exhaustion and uncertainty due to rapidly changing SOPs. In such a demanding environment, leadership became a key factor to determine whether the team could stay motivated and resilient. Effective leaders who communicate very clearly, show empathy and manage workload fairly. It will help the healthcare workers to stay focused and emotionally stable. According to the Malaysian Medical Association from the VIBE 2025, strong leadership and fair scheduling are essential to reduce a burnout and prevent brain drain in the public healthcare sector. The COVID-19 that we know was a turning point for a Malaysian healthcare system. Doctors, nurses and frontliner faced very extreme pressure for long working hours, emotional exhaustion, and uncertainty due to rapidly changing.
Burnout is a state of physical, emotional, and mental exhaustion caused by prolonged stress and heavy workload. In Malaysia, this became very serious during the pandemic. According to Malay Mail, a health ministry survey found that many doctors and nurses experience high level of stress, anxiety, and fatigue. The Director General of Health also emphasized that strong leadership, empathy, and proper scheduling were needed to prevent burnout among frontliners. Beyond the pandemic, burnout remains a national issue. The New Straits Times reported that 2/3 of Malaysian workers suffer from burnout, with healthcare workers being among the most affected because of long hours, emotional demands, and constant crisis situations.
Next, I will move on leadership style in healthcare crisis management. Leadership style play a major role in how staff respond to crisis and emotional stress. During the COVID-19 pandemic, 3 key styles were observed. The first one is autocratic leadership, where leaders make a fast top-down decision that useful in emergency but harmful if prolonged as it causes stress and detachment. The second one is democratic or transformational leadership, which involve open communication and participation. This style builds a trust, motivation, and emotional resilience. The last one is laissez-faire, where minimal supervision that often leads to confusion and poor coordination, especially during critical times. From the news, Free Malaysia Today FMT 2021 noted that proactive leadership with fresh ideas was urgently needed during the pandemic to prevent fatigue and maintain the staff morale. Meanwhile, the New Straits Times 2025 emphasized that strong and consistent communication from leaders is essential for successful change in management healthcare. In addition, the MMA proposal from the news, the VIBE 2025 recommended implementing structured shift system and leadership planning to reduce overwork and improve staff retention.
Leadership plays a crucial role in supporting healthcare workers. There are 3 keys ways leaders can prevent burnout. First, clear communication. The NST in 2025 highlighted that transparent and consistent communication help reduce fear and uncertainty, especially during rapid changes. Second, emotional support and empathy. When leaders listen and acknowledge an emotional struggle, staff feel safer and more motivated. The Health DG stressed that empathy-based leadership was essential during the pandemic. Third, fair scheduling and workload management. The Malaysian Medical Association proposed structured shift system to prevent overworking, which is one of the main causes of fatigue and brain drain in public healthcare. Malaysia's Ministry of Health and Healthcare authorities introduced several initiatives to reduce burnout. First, in 2021, MOH released the Panduan Menangani Stress and Encourage Empathy-Based Leadership. In 2022, mental health peer support units were established to assist frontliners. In 2023, the Flexible Scheduling pilot project was introduced to improve rest time, especially in hospital. In 2024, MOH launched the HEARTS program, focusing on emotional resilience and leadership skill. And in 2025, the NMA called for a structured shift system and stronger leadership planning to address burnout and retain healthcare professionals. This effort shows that Malaysia is moving toward a more supportive and people-centered healthcare leadership model.
Next, I will be presenting about lesson and implication for healthcare leadership. From a Malaysian recent experiences, especially during the COVID-19 pandemic, we have learned and saw how important leadership in healthcare sector. During that time, many healthcare workers are under stress and burnout, and a strong leadership made a big difference in keeping the team motivated and safe. When leaders show a real care and support, staff feel appreciated and work better together. Good leadership also improve a communication, teamwork, and also a patient care quality. That's why leadership program in Malaysia should focus on 3 simple areas. Firstly, emotional intelligence. It is to help leaders to understand their team feelings. Secondly, clear communication under pressure to keep everyone stay calm and be informed. And lastly, fair workload sharing. It is to prevent the burnout and promote a life balance. Most importantly, both the Ministry of Health (MOH) and the Malaysian Medical Association (MMA) highlight that sustainable leadership is the key to a strong and motivated healthcare system. And leadership is not just about giving orders, it is about caring for the people who care for others.
In conclusion, preventing burnout requires more than policies. It requires leadership that communicates clearly, shows empathy, and ensures fair workload distribution. From 2021 to 2025, Malaysia has improved its leadership approach by focusing on emotional support, better scheduling, and staff well-being. As the healthcare system continues to evolve, leaders who listen, support, and adapt will help create a stronger, more resilient workforce. That's all from us. Thank you for spending your time watching our video.